Good afternoon, everyone. My name is Tom Ketchkamethy. I'm the Executive Director of the American Academy of Political and Social Science, and it's a pleasure to welcome you all to our online webinar on working parents and COVID-19, the impact and the policy response. This promises to be a fruitful discussion about the socio-economic prospects of American working parents during the coronavirus pandemic, and our panelists today are spectacularly qualified to speak to this topic, and they'll do so from a variety of academic and policy perspectives. Before I kick off the substantive portion of today's program, though, I want to ask my colleague Walker Irving to speak to just a few technical concerns that will inform you about how the session is going to run and how you can participate in it. So Walker, go ahead.
Great. Thank you so much, Tom. And thank you to our panelists and thank you to everyone here today for attending. We're really excited about this panel. Just a couple of things before we get started. Just a note that this is being recorded and we're going to send out the recording to all of you after the event today. For any members of the media, please note that this webinar is on background only. If you are interested in speaking with someone after the event, just get in touch with us. And my name is in the panelist box, so you can reach out to me there. We are really hoping that everyone will keep this conversation going today. So you can always follow us on Twitter at the AAPSS. And for today's event, we're going to be using the hashtag COVID working parents. We are also going to be taking questions during today's event. So anytime you have a question, please type it in the chat box and we will try to get to as many of those questions as we can throughout the panel. This is how to ask a question. I know we're all pretty familiar with Zoom at this point, but in the chat box at the bottom of your screen, type your question there. If you, for any reason, have any kind of technical problems, can't hear, can't see, please raise your hand under the participant box and we will reach out to you and just make sure that we can help you with any issues like that. And I think that is all we have. So I will hand it back over to Tom.
Thanks, Walker. We're going to move right into the panel now, and that's going to feature 4 brief presentations. The first is going to come from Michal Grinstein-Weiss, a distinguished professor at the Brown School at Washington University in St. Louis. In collaboration with colleagues at Brookings, she's aggressively researching the social and economic effects of COVID-19 right now, and she's also going to be the co-editor of a forthcoming volume of research on how COVID is exacerbating inequality in America. That volume is going to publish through our journal, the Annals, sometime next year. Michal will give us an orientation to how we can think about COVID's effects on working families from the perspective of extant and forthcoming research. She'll be followed by Claudia Golden, who is a professor of economics at Harvard and arguably our nation's leading economic historian. Claudia has made landmark contributions to our understanding of women as participants in the US economy. And her comments today are going to focus on what we know about parents' use of time before and during COVID. Molly Kinder will come next with a brief presentation of essential workers, who they are, how our understanding of essential work is changing through COVID-19, and what's implied in terms of support for families that include parents who don't have the option of doing what I'm doing right now, which is working from their home through a pandemic. Molly's the David M. Rubenstein Fellow in the Metropolitan Policy Program at Brookings, and she also has considerable expertise in global health issues. You'll hear from her today about her research that highlights workers' voices. Our final panelist will be Nisha Patel, whose presentation will address the topic of working families in COVID from the perspective of policy action, based on what we know about the challenges of working families. What do we do? Where do we go from here? Nisha is a senior fellow at the Social Policy Institute at Washington University in St. Louis and was formerly director of the US Partnership on Mobility from Poverty at the Urban Institute. She also served in the Obama administration as a deputy director in the Office of Family Assistance within the US Department of Health and Human Services. So with that brief intro, I'll turn it over to our moderator, Isabel Sawhill. Belle is an economist by training and a senior fellow at the Brookings Institution, where she works out of the Center on Children and Families and the Future of the Middle Class initiative. She's worked in government as an associate director of the Office of Management and Budget, but her expansive academic work has produced research and policy guidance on a wide array of economic and social issues. Her most recent book, released last month, is titled A New Contract with the Middle Class. It was co-authored with her Brookings colleague, Richard Reeves. She is, to my mind, the ideal moderator of this panel. So I'd like to thank her for giving us a piece of her time to moderate this, and to all of our panelists for taking the time to be with us today. So Belle, go ahead and take it away.
Thanks very much, Tom. I really appreciate the fact that the Academy is hosting this webinar. I think it's very exciting and very important. You know, it's interesting that nowadays so many people say we need to listen to the scientists about COVID. And of course, that's right. We can all agree to that, I hope. But I just want to add, in the context of this panel, that we also need to listen to the social scientists. Maybe we don't quite know as much as rigorously as some scientists, but we think we have a lot to contribute. We may not know a lot about viruses or antibodies or vaccines, but we know something about how this pandemic is affecting people's daily experiences. We know, for example, that the effects have disproportionately affected already vulnerable groups. And within those families, there have been especially big impacts on mothers. Now, I grew up in an era when gender norms were very skewed toward women taking full responsibility for home and family. Those norms have changed a lot during my own lifetime. But they're a little sticky, and they haven't changed all that much according to the latest research. And as Claudia Golden, Fran Blau, and others have shown, they influence women's job opportunities and the pay gap, among other things. But today we're going to especially focus on COVID and the fact that we need to do more to address issues such as paid leave, childcare, more flexible hours, and other things that could help parents combine work and family, especially during this difficult period. I think, of course, that the ultimate impact of the pandemic is going to depend on how well we handle the crisis, and especially on what our leaders and our government does. It doesn't look right now to me like we're going to get any new relief bill out of the Congress before the election. And a lame duck Congress may drag its feet as well, with outgoing members wanting to hold on to power and to what they think should be done or not done, and incoming members wanting to wait until January to do something that might be bigger and better than what's currently being discussed. All of this conditional, obviously, on the outcome of the election. Now, however, is exactly the right time, I think, to be reviewing what we do know about the problems that need to be addressed. And as Tom said, we have some of the most outstanding researchers in the country assembled to talk about what we know. So with that, let's hear from them, and let's start with Michal Grinstein-Weiss from Washington University. Michal, over to you.
Thank you so much, and good afternoon, everyone. So as Belle just indicated, and we have plenty of evidence shows, COVID-19 is having a disproportionate financial impact on those who were financially viable prior to the pandemic and experience higher, economic shocks. But it is having a major impact on working families. The Social Policy Institute has administered a longitudinal, nationally representative survey to about 5,500 people that asked more than 200 questions to study this effect on the life of people. And today I want to focus on three main factors that making it difficult for families with children to navigate this crisis. These factors include losing access to childcare, a lack of emergency saving, and insufficient fund and support from the government. So let's first talk about access to childcare. The pandemic has highlighted the fact that what should be a right for all households is in fact a privilege just for a few. As you can see in this graph, our survey showed that during the months of August and September, households with children were 60 times more likely to report job or income loss than households without children. During the pandemic, finding childcare has become more necessary than ever with school closure and kids at home, yet it has become much harder to find childcare for many households. This has likely forced them to make hard trade-off between their job and caring for the children and helping them with the distance learning. In total, we can see, and as you can see in this graph, 24% of families with children reported losing a job or income due to a lack of suitable childcare. This is a lot. 1 in 4 families has experienced a job or income loss. These effects were concentrated in Hispanic household, low-income household, self-employed household, and households with very young children. Additionally, about 1/3 of families with children also reported delaying a return to work or being less productive at work due to the lack of suitable childcare. This is a serious problem. We can see that childcare is influencing not only working family, but the economy at large as well. And our kids are suffering from experiencing this too. A second factor contributing to the financial hardship is lack of emergency saving or liquid assets, which include money in cash, checking, and savings. Liquid assets can serve as a buffer during financial crisis, but only if you have it, of course. While many people lost their job or income during COVID-19, some households were better able to weather the effect of this economic shock. This graph here shows us the relationship between household liquid assets prior to the pandemic and the rate of skipping essential bills during the pandemic. On the left, we see the rate of for those who did not lose a job or income due to COVID-19. And on the right, we see the rates for those that did lose a job or income. Across the board, as expected, higher level of liquid assets can offset the shocks of job or income loss. For example, households with over $8,000 in liquid assets before the pandemic experienced nearly the same rate of hardship upon experience a job or income loss as those who did not lose their job or income. This tells us that liquid assets for those who have it, even the playing field, so to speak, help them buffer this effect. The problem is that, as we know from our work and the Federal Reserve and other surveys, many households, and poor and minority households in particular, tend to have extremely low level of liquid assets, even in the best times. We know that households are struggling as a result of the pandemic, but we can't and we shouldn't lay the devastating outcomes of the pandemic at the family's doors. This is why public benefits such as the CARE Acts are critical. However, another disturbing result from our survey showed that government benefits were not timely or equitably distributed. As you can see here on these pie charts, individuals were left waiting for both unemployment benefit and the one-time economic impact payments. Even if you were unemployed or filed for unemployment, there was a 50% chance you did not receive the benefit. Similarly, 43% of the respondents reported that they were still waiting to receive economic impact payment in late April through mid-May. These delays almost certainly had a disproportionate impact on people who were already more economically vulnerable. Timely allocation of the benefit is as important as the provision of the benefit itself. And in that regard, the government let many Americans down. Nationally, we do not spend enough time talking about working families and the role in inclusive economic recovery. Without a thoughtful, equitable approach to families impacted by COVID-19, the pandemic damage will take generations to recover from. My co-panelists will dive into some of these topics more in length during the remainder of the time. Thank you.
Thank you, Michal. That's really wonderful data, and terrific that you've been able to pull it together so nicely. So it's time to bring in a question or two here. And one question we've gotten from the participants today is about learning hubs or daycare centers where children can be supervised while they engage in distance learning. And this person wants to know, how can we advocate or get more of those kinds of programs and subsidize them? You have any thoughts about that?
So I think using this evidence, bringing more people at the practitioner level, coming together and lobbying that and sharing this evidence. We have partnered at the Social Policy Institute with NAKC and a group of advocates, share with them this data that was not available before, so they can go and use it to create more support. I think Congress should provide more support to this kind of daycares or to working families so they can find ways to establish.
Okay, great. I think these kinds of questions are going to continue to come up, but let's move on to Claudia Golden to see what else we can learn from research.
So thanks very much. Never before have those working on the front lines been asked to bring danger into their homes. In no war have we done that. And never before have we needed to shut down the economy to get it running again, like we're rebooting. And never before has a recession impacted women so much more than it has men. And never before has the care sector been so intertwined with the economic sector. Women are now just about 50% of the labor force, just about half, and we need to make certain that they do not sacrifice their jobs because of care issues, and they do not sacrifice their children because of their jobs. In mid-March of 2020, as we all know, suddenly and swiftly, we descended from BCE, which is before the Corona era, into a during Corona, or what I'll call a DC world. And most workers sheltered in place and worked from home. The lucky ones did. And I'm going to focus in my talk on a group of very lucky people. The college graduate, employed adults and their families. And I'm going to use the American Time Use Survey for the past decade to do that, to compute childcare hours of mothers and fathers by the age of their youngest child. And that's what's on the horizontal axis here. On the vertical axis is the hours per week done by the mother. And the numbers on top is the fraction that she's doing. These are all heterosexual two-parent households. So these parents and their children are clearly in the more fortunate category. The childcare hours of mothers BCE here are given by these dark blue bars, and the fraction, as I said, of the total parental childcare hours that they did is given by the little numbers above the bars. Before the Corona era, college graduate employed mothers living with college graduate employed fathers were doing around 60% of total childcare hours. That doesn't include housework, cooking, et cetera, for which women do 70% in normal times. The descent into the DC, the during Corona world, almost doubled total childcare hours for working couples with children, these fortunate college graduate couples. And these light blue bars denote the hours that mothers gave to childcare, and the fraction that they did is also given. And all of this is derived from a host of little surveys that were done in the US and in England in April of 2020. In mid-March of 2020, almost 90% of school-aged children were not physically in school in the United States. Most childcare facilities were shuttered. That greatly, obviously, increased childcare demands on parents, particularly on mothers. But there was also more parental sharing, since many households had both parents at home at this time full-time. Consequently, as you can see, the fraction of childcare that was done by mothers fell, even as the absolute number of hours greatly increased. In September, which is pretty recent, 2020, we moved into what I'm calling the AC/DC world, because it's after Corona, but it's still during Corona. Draconian pandemic restrictions have been partially lifted and daycare centers opened in most states in early summer, but it is likely that far less than half of all of the nation's public school children are or will soon be in school pretty much full time. In addition, about 1/3 of those who worked at home in May have returned to their workplaces by September. Among college graduates, 40% were in fact never working at home. And of course, women worked at home more than did men. It is likely that in our AC/DC world, total childcare and homeschooling hours are about halfway between what existed in the BCE before Corona world, before March, and the DC world that we fell into in March, April. And that makes sense if schools and childcare are available about half the weeks. Because earnings and promotions rise with respect to uninterrupted hours of work, couple equity remains really expensive for the family unit. One member of the couple will be enticed to go back to work full time and be on call at the office, even if they're working at home, and the other will work from home and take care of the kids whenever the in-person school is not in person and virtual school is in. And that person will also be on call at home. And so it's really the exigencies of the workplace that once again are pulling one member of the couple to remain at home with childcare and the other one to be more full-time in the office. And if history is any guide, or if district website graphics are, the person who will work at home and take care of the children's school needs will be a woman. And this is a graphic from the Chicago Public Schools website. And as you can see, the person who's reading to the child is the mother. There have probably been no net gains for working women in the AC/DC world. Their total hours are given by the green bars. What they gain from minimal school and daycare openings. They lose from lower parental help at home. In consequence, their total hours remain about the same as in the DC March, April 2020 world, but their share of total childcare, as you can see from the little numbers, increases. For most mothers in the ACDC world, it is the BCE world on steroids. Solution: we need to find a safe way to have classes for children, for their futures and for their parents. As in the Great Depression of the 1930s, we have highly talented, unemployed and underemployed labor who could be put to work educating children, particularly those from low-income families. We once had a Works Progress Administration, CCC program. And what we need now is a new CCC program, a civilian college core program, to free parents, especially women, to return to work and give work experience to unemployed college students. The core could support beleaguered parents too exhausted to correct essays and too confused to help their children with algebra. Other core members could be in the classroom helping districts cope with reduced numbers of older teachers who don't want to return to the classroom buildings. In the ACDC world, we must reduce the cost to parents of educating and caring for their children and improve learning for future generations. Thank you.
Thank you, Claudia. I think you've created a new vocabulary for all of us. I love the idea of talking about BCE, DC, and then ACDC, if I can remember what they stand for. But your point that ACDC seems to be like DC on steroids. I think I got that right.
No, like BCE on steroids. That's okay.
Is going to stick in my mind. So here's a question that's come up. Is it possible that we as Americans suffer from a bigger overall problem that causes women to still be the default parent, and that the pandemic has increased this dynamic significantly? In other words, how do we shift that mindset? I think this is really a question about how do we change gendered norms. And your picture from the school system that set out the cartoon that was clearly a woman reading to a child was, I think, very pertinent to that.
Right. There are two things. There are gender norms and there's work organization. And unless we fix work organization as well, we're going to be faced with couple equity problems. So let me dig in. Even if we had all same-sex couples aren't going to have gender norms problems, but they're still going to have couple equity problems. There's still going to be a problem if the workplace gives greater promotions and earnings to the person who's on call all the time and puts in the hours. So that creates the great divide. Then we then add to it the gender norms. But even if we didn't have gender norms issues, we would still have couple equity problems. So there's really both problems.
Okay, another question is about your proposal for a CCC, Civilian College Corps, if I've got the acronym right now. And this person wants to know, the question is from Cabrini Pak, how that's going to work logistically. Is it going to be a collaboration between higher education and industry? Is it going to be government run? How do you see it working?
Well, that's very, very good. And let's work on it together because I haven't figured it out.
So you're open to other people thinking more about that.
Not
I might,
only am I open to it, but I would love for people to figure this out, because it's something that we should be doing. We should have been doing it for months now. Okay.
yes, I very much agree. By the way, Richard Reeves and I wrote a lot about this in our new mini book on the middle class. We have a similar proposal. Okay, well, let's move on now to our next panelist. Thank you so much, Claudia. And that's Molly Kinder, my colleague from Brookings. And Molly, over to you.
Great. Thank you so much, Belle. I'm delighted to be speaking today, and to follow Claudia, I identify with the population Claudia was just speaking about. I am part of a dual income couple with 2 small children who was stuck at home together in the beginning of the pandemic, and I resonate with a lot of her themes. What I'm going to be talking about today is a very different population. I'm going to be talking about the frontline essential workers and the challenges facing primarily the low-wage frontline essential workers who are navigating this pandemic with children. So the challenges that I'm going to be speaking about are quite different than some of the challenges that I've faced as a more affluent, more fortunate working parent. And for this, I actually have a new report coming out today in Brookings where this data that you're seeing now is going to be included. I asked the question, who are the frontline essential workers that are working through this pandemic, not the essential workers who have the ability to work from home, but those who actually have to go into the workplace in order to complete their tasks. My colleagues from Brookings, Adi Tomer and Joe Kane, they did an earlier analysis and they find there are about 50 million workers classified as frontline essential workers. I went a little deeper to say, well, how many of them are low wage? And I found just under half earn less than what we would consider a living wage. So in MIT's definition, that's about $16.50 an hour. And if you're just looking at the $15 an hour threshold, which is a very pertinent number, a lot of folks are advocating for the minimum wage to go to 15. I found that there were 19 million low-wage essential workers making $15 an hour or less. And that's data I'm going to be putting out this afternoon at Brookings. This chart looks at those low-wage frontline workers, so those who are making less than that living wage threshold. Not surprisingly, these workers are disproportionately Black and brown. So you can see here the comparison in the red to low-wage frontline workers and across race and ethnicity versus the gray, which is across the US workforce. And really the takeaway that I'd want to convey here is the workers in America that are risking their families' lives to provide us critical services are almost half of them do not even have the dignity of a wage that would just provide the basics for those same families. And disproportionately, those burdens, that financial burden combined with the risk to health, fall disproportionately on Black and brown workers. And at the start of the pandemic, I wanted to better understand not only the data, like what are the numbers, but what are the experience of some of these workers? What are they going through? And what does that tell us about the research questions we should be asking and about the policy solutions that we should be advocating for? And at Brookings, we have a very large platform to do just that. So starting in the beginning of the pandemic, I started interviewing frontline essential workers with an emphasis on Black and brown workers and those making less than a living wage. To date, I've had about 4 dozen interviews, sometimes going back to some of these same workers throughout the course of the pandemic to learn how their experience is going. And they're in the occupational groups that you probably would imagine when you think of a frontline essential worker. I've talked to grocery cashiers, home health aides, cooks and cleaners at nursing homes, low-wage hospital staff. I've talked to meatpacking plant workers and gig workers, retail associates at big box stores. And I also talked to some slightly higher wage workers like registered nurses and mail carriers. And what I did with this group is in part to share some of this in some of my writing, but a subset of these workers, especially those who are members of unions and are particularly protected and wanted to speak up, have shared some of their personal stories with us. So we've actually highlighted their personal experiences in some of their profiles. And I'm going to give you a few examples of that to share with a few stories, some of the themes that have arrived. So in this picture, you see 3 workers. The 2 on the left are workers. The first is Sabrina on the left. She is a housekeeper at a nursing home. Yvette in the middle is a home health aide in Philly. And on the right, I have just a picture I drew from the internet. It's representing a story of someone I'm not going to identify. It's a poultry plant worker who is a mother of school-aged children. And there's three themes that I want to talk about that these personal stories represent that came out loud and clear in some of my qualitative research and backed up by the data, the quantitative data. And the first is around safety. And this is something that Claudia alluded to. The first question I asked everyone in interviews is, what is your experience like as an essential worker at the front line? The first thing any parent said was, it's terrifying because I'm afraid for the safety of my family. Always the first thing people talked about was not their own health vulnerability. It was the family that they would come home to. And what I found so heartbreaking about this, you can see everyone here in this slide are single mothers or grandmothers. They are all working so hard just to try to provide for their families. And the cruelest part to me of the pandemic is those same mothers who are working so hard just to provide the basics. That job, which is for their family, now has them coming home and potentially risking the lives of their family. And that causes just so much pain for these predominantly mothers who are worried about this. We've all seen the data that talks about how low-wage workers and workers of color are disproportionately have the underlying health conditions that would make COVID more serious. This came up over and over in my interviews. So for instance, Sabrina on the left, she suffers from asthma. Her son who she lives with has asthma and is a cancer survivor. Yvette in the middle has a whole range of health issues from heart conditions to blood pressure, and so do some of her children. But really what they are most concerned about is bringing this home to their family. And the stories I heard of the rituals people would go through when they came home to their apartment or their house to try to protect their family, scrubbing themselves down, leaving their clothes, Lysoling everything was really pretty heartbreaking. And the tie to this is the second point, which is around the ways in which low wages make this worse, make the experience of these workers worse. First, I would just say that most of the workers, the frontline workers I interviewed, didn't feel like they had a choice, even if they felt that going to work was going to provide a risk to their family or to themselves. They had to keep paying their bills. They did not have that safety net. There wasn't really a good public program that said, if you're a certain age or there's family members who are vulnerable, you can take a back seat and be supported. They felt they had to do it no matter what. And being low wage put themselves and their families at greater risk. A lot of folks live in multi-generational housing, not by choice, but because their wages weren't high enough to be able to afford to live separately. Sabrina lives with both her son and her daughter and her granddaughter. She said if she made more money, she would live elsewhere to protect them, but that's just simply not a choice. Yvette is the sole provider of a family of 7, and she cannot afford to live separately from them. Yvette also takes public transportation to work, and she said it's like getting on a bus during COVID is like getting on the bus with a loaded shotgun and not knowing who's going to set it off. She doesn't even have these simple luxuries of trying to keep herself safe. And there is not this huge distinction between frontline workers who've managed to keep their jobs and unemployed workers who have lost their jobs. We already have heard how low wage workers and workers of colors disproportionately have lost their jobs. It's often in the same households as families with frontline low wage jobs. So for instance, Sabrina's daughter lost a job at a fast food restaurant. So she's now trying to provide for her family with just her wage. Same with Yvette. She had a son who lost a job as well. So these very meager wages, Yvette makes $12.75 an hour. She's trying to stretch that even further because of the pandemic recession and the failures of our public policy response to adequately protect workers who are unemployed. And then the last point I would just make is the one about education. So we just heard from Claudia the challenges of parenting in a pandemic. It's not surprising to hear that these challenges are magnified by parents who have frontline essential jobs where they don't have the ability like I do to work remotely. unbelievable sacrifices when you cannot afford childcare. The woman that I'm referencing on the right, who I'm not identifying, her mother normally would look after her kids, but she can't now because of the risk of the pandemic and her dangerous job. And she thought, well, my children are doing remote school. I wish I could just quit my job and be with them. That wasn't an option for her. So she was hoping to at least maybe take the first 1 or 2 weeks of the school year off unpaid. And even that was going to be a huge stretch. So just enormous sacrifices facing these frontline essential workers. Through all of these stories and these experiences, I've used the Brookings platform to try to advocate for some policy solutions, weaving in some of these stories I've heard. I have a piece coming out today that's going to go back to the report I did on the top left, which was calling for federal hazard pay. I called for this in early April. There's been a lot of talk about federal hazard pay. This would be something that would disproportionately benefit these low-wage frontline essential workers, workers of color, who are sacrificing the most. Unfortunately, the headline of my report coming out today is federal legislation has gone absolutely nowhere. It doesn't look likely at all that this will happen. Some state governments have stepped in with some innovative programs leveraging the federal CARES dollars, but the scale of it was just so much smaller than the need. And companies, a lot of retail companies initially offered small hazard pay and have subsequently ended that. So that's really disappointing in a key area. Minimum wage would be make a big difference to these workers as well if we could raise that to $15 an hour. And then I get into other topics like benefits, the importance of paid sick leave, paid family leave, and worker voice, frankly, that a lot of workers who are facing these risks, do they have the ability at work to voice their concerns and make their workplaces safer? The workers in these pictures are disproportionately unionized. They could speak up to me and to the public, but a lot of workers can't. And their workplaces, they felt, were even less safe as a result. So those are some of the themes. And I think the main takeaway is we are not, as a country, from a public policy perspective, or frankly from employers, meeting the basic needs of the families who are sacrificing the most in this pandemic.
Molly, thank you. That was fabulous. And I think what I was struck by is the theme that inequities come in buckets. The same people who have low wages are also the people who live in households where jobs are being lost. They're the same households that have low health to begin with, or poor health to begin with. They're places that are people who have to live in multi-generational houses or get to work on risky transportation. So it is the kind of compounding of these risks that I think you bring out so beautifully. In terms of questions, we have one from Liz Foyles. Sorry if I'm mispronouncing your last name. She says 865,000 women dropped out of the workforce in September versus 216,000 men. So, you know, almost 4 times as many women as men. And she says, do we know if this disparity is due to the layoffs mainly occurring in industries in which women typically work, such as retail and hospitality, or is it due to something else? You have any thoughts on that?
Yes, I mean, there's been a lot of writing, even just today. There's a great piece in the Upshot from Ernie Tedeschi that looks exactly at this question. Is this a push or a pull situation? My understanding, this is primarily people leaving because of childcare constraints, school issues. We're actually seeing some growth in job opportunities, not necessarily contracting in those same industries. So my sense is this is more of a situation of women leaving the labor force because of so many of the issues that Claudia spoke about in terms of the dramatic constraints. There is, of course, a she-cession going on because the job losses have been so hard hit in sectors where women dominate, such as hospitality and leisure. But I think what you're seeing in the more recent numbers reflects, frankly, just the challenges that working women are facing that are just too much for a lot of women to handle. But I'd welcome others to answer that as well. Maybe Claudia has thoughts on that.
Yeah, I think maybe we could come back to that. You're saying you think it's more of a supply than a demand side problem, but it's a very interesting question. Let's bring Nisha in. So please, Nisha, that you could be with us today. And you have the really tough job of telling us what we could do about all of this. or at least helping us think about it.
Okay, here we go. And hopefully you all can see the screen. Let me just make this bigger. There we go. So yeah, so I do have the tough job. So let me see if I can pull some themes together. And I realized in planning for this that I have to do 3 things and I have about 8 minutes. So I'm going to try to speak clearly, but pretty quickly. So I want to, much as my co-panelists did, share a few pre-COVID data points just to sort of set the baseline and the context. Kind of rapid fire, talk about what the key federal policy responses have been to date. And I'm going to give you quickly sort of what I think the good news and the bad news is, and it'll reiterate and pull together some of what you've heard earlier. And then end with some thoughts on how we might structure future policy. So on the first piece, I think, again, it's sort of been reiterated. It's very apparent to everyone listening that it's not as though the pre-COVID context was great for lots of people, for people working in low-wage jobs. Particularly, you know, it has exacerbated racial, gender, and other gaps in opportunity, and it's increased pressures on systems that already weren't working well for lots of people. And I didn't create a chart for this, but something I wanted to just highlight and name is that very specifically, pre-COVID and for about at least the last 5 decades, we know that nationally, the Black unemployment rate is almost always 2x the white unemployment rate. And so even in the so-called tight labor market that we had prior to COVID, you know, when we had low single-digit employment rates in many places, we know that racial discrimination by employers was a significant factor, and that continues to be a factor. And then this is the only chart that I'm going to pop up, and I'm going to get into the policy, but I wanted to just highlight, this is sort of a slightly different cut on something that Molly had talked about. We know that disparities by race, gender, as well as immigration status have persisted in terms of who's working for low wages. And so in this analysis, we use $12.50 an hour. And we know that women, and you know that includes many women who are mothers, who are parents, are far more likely to be working in low-wage jobs than are men. We know that greater shares of Black and Hispanic people are working in low-wage jobs than are white people. And then when we look at that together, race and ethnicity together, we can see that only 20% of white men were working in low-wage jobs pre-COVID versus almost 40% of Black women, 46% of Hispanic women. And then we layer immigration status on top of that, and the disparity becomes even greater. 60% of Hispanic women who are non-citizens, including legal permanent residents, were working in low-wage jobs. So that's 3 times as many as white men. And I want to note with this analysis, which I did with colleagues at the Urban Institute, if we were to look at Native Americans, Asian Americans, and Pacific Islanders, we would likely see differences. And these are data from a paper that I co-authored entitled Restoring the American Dream back in 2018. And one of the things that we highlighted is that many of these jobs, care workers, food service workers, are essential. And so it's, you know, I guess, I don't know if I'm pleased about anything in this pandemic, but I'm pleased that there's been more attention to these workers. And as I think Molly already highlighted, disproportionately, these are workers who are people of color, who are at increased risk for COVID-19. The thing that I guess I just want to underscore here is just to remember in a so-called good economy, lots of people were locked out of opportunity. And in terms of policy solutions, we have always needed ways to supplement or replace wages. So that's not, you know, from employment. That's not something that's only in the pandemic. So then along comes the pandemic, and what was the federal policy response? So it was largely put in place in March, and this thing has dragged on much longer than perhaps most policymakers at least anticipated. The response was far from perfect, was not universal, but primarily the response was designed to get direct cash to the majority of people in the United States through 3 primary mechanisms. So the first one was economic impact payments, which Michal referenced in her presentation. So these were one-time payments, $1,200 per individual, an additional $500 per child, up to an income threshold of $75,000 for individuals, or a threshold of $150,000 for married people filing jointly. But without regard to people's current employment status, right? This was based on their prior year tax filing. So the good news is that for a lot of people, probably folks that are listening into this webinar, you automatically got money in your bank account by a direct deposit, if that's the way you might have received a tax refund previously. Though for other people, and you saw this in Michal's data, people who perhaps made too little to file for income taxes in 2019, people who were unbanked, who didn't have bank accounts, had long delays in receiving those payments, or perhaps are still waiting to receive those payments. So that's a bit of bad news. The other bad news is that it left out significant share of folks in the low wage labor market. It left out undocumented workers. It also left out anyone living in a mixed status household. So if you were part of a household where, even if you yourself are a citizen, if someone in your household has, is an undocumented worker who's an ITIN instead of a social security number, you weren't eligible for those payments. And arguably, there were people who didn't lose jobs or income at the sort of upper end of that income threshold who didn't need the payments who received them. So it wasn't necessarily the most efficient, the most targeted way to get resources to people. Second policy response was pandemic unemployment assistance. So this added an additional $600 per week in federal benefits to state benefits, which was really significant. For some low-wage workers, who were fortunate to receive the benefits, they actually received more in unemployment benefits than they had received in weekly wages, which I think that's an indication that they were being severely underpaid for their labor when they were employed and able to work. The good news is it covered a bunch of workers who aren't typically covered by state unemployment systems. So PUA, Pandemic Unemployment Assistance, covered part-time workers, it covered people in the gig economy, it covered self-employed workers. And so that's something that I think that we can learn from for future policy responses. Bad news, pretty significant challenges with state unemployment systems. A lot of these systems are clunky, they're out of date, they don't work well. Lots of people who were eligible experienced challenges and long delays in accessing benefits. And I would say, to put it mildly, state unemployment systems really need a 21st century makeover. And the other bad news is these benefits ended in July. Clearly the need did not. We still have pretty high unemployment rates and people who are unable to work because of health risks or caring for family members, including children. Which brings me to the third response, which was the Families First Coronavirus Response Act, which was focused on paid leave. And it required certain employers, not all employers, but certain employers to provide paid sick leave or expanded family and medical leave for reasons related to COVID through December 31st of this year. So in general, and I'm simplifying the complex for time reasons, but generally employees are available for 2 weeks of paid leave if they have to quarantine or if they're experiencing COVID symptoms and waiting for a medical diagnosis, or if they're caring for someone who has to quarantine, or if they're caring for a child whose school or childcare provider is closed, which you heard earlier in the panel, that's impacting lots and lots of people. And then eligible for an additional 10 weeks of paid leave for childcare reasons, expanded paid family and medical leave if a parent is unable, or a caregiver is unable to work because a child's school or childcare provider is closed. So it's a good thing in the sense that, at least anecdotally, what I'm hearing from advocates on the ground, it seems to be easier to access than unemployment for some workers. And so in terms of access, it seems to be a little bit better for those who are eligible. The bad news is that the policy only for private employers only covers employers with 500 or fewer employees. So this means it leaves out large corporations where we know a large number of low-wage workers are employed. So this wouldn't necessarily be available to those workers. Okay, and then that's the direct cash. I wanted to quickly hit on childcare and housing because it's important to do. I don't even have time to go into the Paycheck Protection Program. But with childcare, Congress appropriated an additional $3.5 billion in funding for the Childcare and Development Block Grant. So the good news is it did help some providers be able to stay open during the pandemic and provide care, including care for essential workers, some of the folks that you heard Molly talk about in her presentation. The bad news is it clearly didn't meet the need. And I think every single panelist that you've heard from has emphasized that. So, I mean, good that it was there, but there's so much, the need is so much more. And in fact, we're in a situation now where many childcare providers are in danger of having to close. And so that's going to be a challenge even once we're on the other side of this, because how is our economy going to function if working parents don't have childcare? Last thing that I'll hit on is housing. And one of the big federal pieces here was the CDC Center for Disease Control Eviction Moratorium Order. which goes through the end of the year, expires on December 31st. So the good news is it seems to be temporarily preventing some evictions, preventing families from becoming homeless temporarily. The bad news is it does expire at the end of the year, which is right around the corner. And once it expires, unless it gets extended, people are still going to owe that back rent. You know, that money that they owe doesn't magically go away, and it's likely that many people are not going to be able to pay that. So what is the big kind of takeaway from all of this? I would say my big headline is the importance of direct cash. This is not a new idea, and I'm sad to say it's a lesson we seem to have to keep learning, but the importance and the efficiency of getting direct cash to families to be able to both survive and thrive. Beyond government, there have been actually numerous philanthropic efforts nationally around the country to get cash to workers who were left out of the government response. So nationally, I would highlight the funds that were set up by the Family Independence Initiative, by the National Domestic Workers Alliance to get $500 to families. Those are great examples. Here in DC, where I live, Bread for the City, which is a community-based organization, and their partners have launched something called Thrive East of the River, which is providing $1,100 a month or $5,500 in a lump sum to families over a 5-month period. And so those have been important gap fillers. There have also been some interesting public-private partnerships. So California, for example, allocated $75 million in state funds to provide disaster relief assistance to undocumented workers who were left out. And then philanthropy kicked in another $50 million worth of resources. And then lastly, I don't want to leave out mutual aid, which has been happening at the grassroots level in communities around the country. There is a long history of mutual aid, particularly in communities of color, and I think there's a lot to be learned actually for federal policy from those efforts. So to close, what next? I hope that, at least this is what I hope what happens next. I hope that we have a phase of reimagining policy responses and solutions. In the short term, Congress needs to act, needs to get its act together and pass another relief package. Don't know how soon that will happen, but it's got to come. And then long term, you know, what I would say is nearly every system, every policy system has been disrupted, particularly those systems that have perpetuated historically inequities for people of color. So rather than going back to the status quo, there's an opportunity to reimagine the policies that we want to create and act. And in so doing, I think it's really important that we learn from some of these temporary measures that were put in place. Let's build it back better. These policies were imperfect. They did a good job of reaching some people. It left a lot of gaps. So let's learn from that as we design what a future safety net could look like. And I would say that is my bottom line. It's very clear we need a stronger safety net that includes getting cash directly to people. So maybe that's something we can deep dive into if we've got time for discussion, and I will stop there.
Nisha, thank you. You really did pack a lot into your 8 minutes, and it was terrific. I want to just pick up on your last point and ask a question of my own, and then I'm going to turn to the other questions that are coming in. On building it back better and thinking about cash assistance post-pandemic, I don't know what post-pandemic is in Claudia's acronyms, but I guess it's AC after coronavirus. What are you thinking about? Are you thinking about a universal basic income, a children's allowance, or are you just thinking more generally?
No, I think those are good ideas to sort of put out in the universe for discussion. I don't think I personally would advocate for a universal basic income because not everybody needs one. For example, most people on this call, right, don't need that. So I'm not sure that's an efficient or good use of taxpayer money. But some level of basic income to guarantee that everyone has an opportunity to survive and hopefully a pathway to be able to thrive. And I think child allowances are potentially a good start to something to think about. And I think one of the keys, you know, one of my areas of policy expertise that I've spent a lot of my career working on is TANF, right? What we think of as traditional welfare cash assistance, but we tie so many strings to that. And we have so few people. The last numbers I looked at, there were like pre-pandemic, I think 920,000 families. So you compare that to the number of people that benefited from unemployment, economic impact payments, clearly the need is much more. And so I would say we need to blow up programs like TANF and think about something that has a lot less conditions, a lot less restrictions on it, and meets much more of the need. You know, as I think every single person has talked about, for people who are working for low wages, they're not currently earning enough to be able to thrive. So we have to have some way, unless we can change employer practices, which is one route to go down, we have to think about other ways of supplementing income at larger scale.
Okay, we have a question and comment from Gina Adams at the Urban Institute. And as I understand her question, it's about informal childcare. That in a period when you might be concerned about sending your kids to an organized daycare center, you might have in-home care or family care, but that is not getting much help right now. And what thoughts do you have about that, if any? It's interesting that you talked about mutual help and at the community level, and I'm glad you added all of that. And maybe this is a little too detailed for you, but if you have any thoughts on it, go for it.
I mean, I think that speaks to the, yeah, I mean, it's, you know, one way to efficiently get to that is direct cash, because if families have cash, they can choose to spend that cash on childcare and pay whomever they like to care for a child, or use that cash to buy food or to buy diapers, whatever the need is. So I think getting more cash to families is one efficient way to get at that. Potentially less efficient way is to maybe, you know, you could allocate funds specifically for childcare, but then you'd have to figure out how those funds get channeled to the right place. So I think I'd advocate for more flexibility, direct cash, but others may want to jump in on this.
Okay, good.
I would just add that when I did some interviews with a bunch of frontline workers with kids, I was asking specifically, this was early on, about whether governors should declare grocery workers or different categories first responders so they could access some of these free childcare programs. I was actually surprised by some of the reluctance of parents to want to send their kids right during the pandemic into formal childcare. They were more comfortable cobbling together through relatives and various things. But of course, the added wrinkle that older relatives have COVID needs. So just putting out there that I was surprised that there was as much resistance as I heard.
Interesting. Okay, I'm going to invite some of the other panelists to come back in if they want to respond to each other's presentations or to any of the questions that have been coming in. While you're thinking about that, another question that's come up recently is about the new GDP numbers that have been reported today, showing that the economy is coming back strongly. And this person is wondering what's accounting for that. And I think that a first attempt at an answer would simply to be say, when you go into a deep hole, you've got a lot of ways to climb back, and it doesn't mean you're back to where you were. It just means that because you're in such a deep hole, you have quite an uphill wall to climb as well. And so who else wants to come in at this point while I have a chance to look at whether
Isabel,
there are
that's
new questions?
exactly the way I would put it, and I would then look at how far out of the hole you climb with this great increase. And the point is not enough.
Right. Do you happen to know, Claudia, about how far back we are to pre-pandemic? About halfway or something like that. Yeah.
Numbers, but we're still, you know, not out, and it's obviously particular sectors. Right. So interestingly, you know, construction, manufacturing are the ones that have led to this huge increase. The more male sectors, and the ones, I mean, let's face it, I don't see an airplane in the air very often, and we're not going to hotels. Hotels are being repurposed in various ways, but they're not going anywhere. Winter's coming. What's going to happen to all that outdoor dining? So it's interestingly, all the services that we thought were protected from offshoring, from China, and from automation, And so that's where the hole still is.
Right, absolutely right. So here's another question from Deborah Schaefer. What solutions does the panel believe can we come up with for older children, for teenagers? Because her point is that working parents need solutions there as well, and we're less organized to deal with that. Anybody have any thoughts about that? Molly.
Can I cheat a little bit and answer a different one of Deborah's great questions? Because there was another question that really jumped out at me. Her point about workplace flexibility. And I think often when we think about workplace flexibility, we're thinking about it sometimes in more of a white collar job situation. But the frontline workers who are hourly workers, a lot of them have these draconian point systems where they have an unexcused absence, just a few of them, and they're fired. And my impression is that some of these employers provided more flexibility at the start of the pandemic, and things are quote unquote back to normal. At the same time that employers are stopping hazard pay and these extra safety measures, I'm hearing from frontline workers that some of their employers are going back to these very strict attendance policies, making it extremely difficult. When last week trying to prepare for this panel, my caregiver came down with symptoms of COVID and I lost childcare, and this panel was extremely accommodating of me having my children interrupt the panel. That's just not the case if you're at a meatpacking plant or a warehouse or some of these places. So I think this issue of workplace flexibility we have to think about it very much also from a low wage worker perspective as well.
Also,
right.
Just to add on that, if I may, we also have evidence that from our survey that low-income workers reporting that even if they have symptoms sometimes of COVID, that might be of COVID, they are afraid to take time off or to say, and they're still, going to work because they need the money, and that's bad for them. That's bad for the potential and the possibility of infecting others. So there is so many things that are, just related to that.
I think that's so true, and I think we have had a tendency even before the pandemic for people to think they need to go to work when they're sick because they need the money, and even if they don't need the money, they're going to be penalized in terms of their job advancement, et cetera, if they don't come to work and stay home. And that's one reason I think we need more sick leave. And I think that's several of you have talked about that. I want to think about bringing this to a semi-close and turn it back to Tom to close us out. Let me see if I can at least create a to-do list for policymakers, or a possible to-do list for policymakers. Obviously, there are a huge number of issues in terms of what that means in any detail, but it would include thinking about hazard pay, as Molly talked about. It would think about talking about the CCC that Claudia talked about. It would we should think about the minimum wage. Of course, that was something that was on the table even before the pandemic. Paid leave, sick leave, as we just said, is got to be addressed. And also, as Molly said, I think worker voice, and how do we do that in an era when unions have shrunk to a fairly minuscule size. So I'm going to leave it at that. I just want to thank all of you for fabulous presentations, great data, very well organized talks. I'm just totally impressed.